Mammogram rates have dropped since the new United States Preventive Services Task Force guidelines changed the screening age for women from 40 to 50 years of age. And the Radiological Society of North America claim that 20% of the breast cancers are being missed, and the American Cancer Society is holding out in favor of yearly mammograms at age 40.
Yeah, see, there are a lot of conflicts of interest here that make it very difficult to understand when literature like this comes out, because the first thing you see is that all the radiologists are saying, we're missing a lot of cancers in that group that's between the age of 40 and 50. Well, you have to look at what that data really says very carefully, or you get the wrong impression.
Because it's kind of skewed the way they write it.
Well, it's a turf war. I mean, they want to continue doing what they're doing. They don't want to stretch themselves to go further, the radiologists don't, to include other tests which could be much more helpful than the tests that they're using for mammography.
However, they are recommending a test that's mammography where they add dye to
Well,
the
see,
mammogram.
they've been doing things like that for the last 2 decades because they know that the mammograms, first of all, miss too many cancers, and second, overdiagnose too many, and that leads to way too many women being overtreated with surgery, chemotherapy, and radiation. So we've got a major issue here, and everybody's confusing it. I think the United States Preventive Services Task Force is on the right track, and so is the rest of the world, because this is the only country that's recommending, in the whole industrialized world, mammograms for women under the age of 50, and it's for the reasons that I just said. So the mammogram is not a perfect test, and when you're looking at women who have dense breasts, as so many women do that are in that age that are premenopausal,
They're younger, yeah.
Yeah, you're going to see more cancers.
Maybe we should talk about what dense breasts are. What's the definition of dense breasts?
Well, a dense breast just has more tissue in it that is nodular and like fibrocystic. But there's a difference between just normal dense breasts in young women as opposed to old women and fibrocystic disease, which has a 4 to 6 times increased risk for cancer.
And they also look like cancer, don't they, on mammograms?
You can't tell them apart that easily. It's because the tissue density is about the same. It's like we say, it's like flying over the North Pole looking for polar bears because the snow is white, the polar bears are white, and you can't often see them separate. And that's the same thing in fibrocystic disease when you're trying to separate it from a cancer.
But this is important because dense breasts quadruple the risk of breast cancer.
That's right. Well, it's fibrocystic breasts that do, not just dense breasts. So this study that was done out of Cornell University is what these scientists are basing their comments on. And they screened 14,500 women and found 21 invasive cancers in the group that were under the age of 50. And based on that, they're saying that 1 in 700 of these mammograms actually turned up another cancer. Well, that's probably true. But how many people are going to be diagnosed who don't have an invasive cancer, who are going to have what's called ductal carcinoma in situ, which is 97% of the time something you'll die with but not from, is the real problem here. So we've got the tail wagging the dog here, rather than trying to be clever about using a test that works better than these mammograms, which are way overused and lead to too many problems.
Yeah, and then they start doing MRIs with dye, and the dyes can have
problems as well.
Yeah, that you don't want.
Well, plus the MRIs way overdiagnose the problems that are in breasts, because you can't differentiate cancer from non-cancers a lot of the time. So it leads to more diagnostic testing, more biopsies, more overtreatment because we're finding cancers that will never become invasive.
And yet they keep ignoring breast thermography.
Yeah, that's the thing that's really annoying.
We talk about breast thermography on drsaputo.com, so if you put that in the search box, it'll pop up for you.
Go there, and you'll get 30 or 40 different audios and videos on that are short and easy to understand. We'll be talking about what we're about to just touch the surface of.
But, I wanted to talk about, tests and doing all these tests. This is what the medical profession does, trying to detect cancers and so forth. But, a lot of these CT scans or PET scans where they're injecting dye and so forth that they do to
For diagnostics.
for diagnostic purposes, like for your heart, when you for a stent or for
It's
an
coronary
angiogram and that
coronary
kind of thing,
arteriography.
or just of the chest.
That's right.
But those increase your risk for getting breast cancer, and also cancers.
Even the mammogram does.
Yeah, and X-rays of the spine too. Even
Any
it
X-ray
just absorbs, your breast just absorbs that radiation.
any X-ray that you do, see, when you take a mammogram, you're getting about the same dose as a chest X-ray, and you think, well, that's not much, and it doesn't seem to cause much in the way of cancer.
You do that every
But
year.
Well, you put all that radiation in just the small area of the breast, not the whole chest. Now you're talking about an increase in density of radiation into the breast tissue,
concentrated.
and your risk for cancer goes up. Because the fact is that there was a study done on women who have the BRCA gene defect, which puts you at a very high risk for getting breast cancer. If you have one chest X-ray under the age of 20, the risk for developing a cancer from the BRCA gene defect goes up 250%. So you're not looking at tiny things here.
Well, another thing just to think about, I'm not telling you not to do it, but just to think about it, is that many times when women have had breast cancer, the doctors want to keep checking them to make sure it hasn't spread.
So you're doing PET scans.
So you go in
PET
and you
CT
do these,
scans.
you do these scans again that have radiation in them, which can increase your risk for having it spread.
Well,
so you might be increasing your risk for what they're looking for.
Well, you get caught between a rock and a hard place if you're a doctor and you're trying to assess, has the cancer come back? So I can understand that, but Vicky's point is well taken, because it does increase the risk for getting cancer.
But it makes you think about it, too. Like if you want to volunteer and help out at your child's school, many times they require that you have a chest X-ray.
Yeah, well, that's right.
Or if you've had a positive TB skin test and they make you have a chest X-ray.
All these things are changing. In the United States, Preventive Services Task Force has come out with a lot of information about what's a routine test that should be done and what's a routine test that's being overdone. So when we're looking at the mammography industry, they're in a very they're a fight for their survival in this turf war. They're clinging to what I would call a failing test in women who are under the age of 50.